Hi guys, welcome to Raaonline. So today we are going to see an infectious disease pertaining to the diphtheria. So whenever we are going to learn about a particular infection, it's always better to learn both the theoretical aspect and case related aspect. So whenever we are going to learn the case related aspect, it's going to be very much useful for your clinical practice, and during your house urgency you are going to treat the case. So you will not miss out diagnosing certain infection, and always try to apply whatever you are going to study in clinical microbiology in the particular infection. So each subject which you are going to learn in your second year, it's going to be very much useful for your various diagnosis. Example, in case if you are going to learn pathology, try to apply those particular knowledge in the tumor and leukemia and various kind of anemia. In case if you are going to learn the pharmacology, again you will be applying that particular pharmacological drugs in the various treatment of certain conditions, it can be either infective or non-infective. And whenever you are going to study the microbiology, try to apply the theoretical science which are going to be learning about the particular infection in diagnosing certain condition, and what are the various lab diagnosis and lab diagnosis pertaining treatment, everything you should be able to learn. So today we are going to learn about the respiratory infection, that is the diphtheria. So in the last session we have seen about the theoretical aspect of diphtheria, and here I will show you a case study, and with that I have a set of questions that can be answered. So this is a case study. So here we have a 4-year-old child who was brought to pediatric OPD with the complaints of irritability, fever, and child refusing to take food, and the child complaining of throat pain. So the examination, the child is going to be febrile, so which means that the patient is going to have fever, and the local examination revealed the presence of grey-white membrane in the pharynx, and vaccination history was not good. So this is a case study, and let us see the questions. So what is the diagnosis? So what are the points favoring the diagnosis? Etiology, the clinical condition is mediated by what? And pathogenesis, what is a special strain useful in this condition? And what is a special culture medium which is useful in this condition? Note on toxigenicity testing, note on anti-serum, and note on antibiotics useful in this condition, and note on vaccination. So here we are having a 4-year-old child, so pediatric age group, and there is going to be a complaint of irritability, fever, and the child not taking food and complaining of throat pain. So here there is going to be the inflammation of the pharynx, and that's why the pediatric child is not able to take the food. And on examination the patient is febrile, and local examination revealed the presence of grey-white membrane in the pharynx. So there is going to be a presence of grey-white membrane, and there is no adequate vaccination history. So in case of a pediatric age group, we all know the pediatric population, they will receive the DPT vaccination. So here the vaccination history is not good, so a particular child would not have received the DPT vaccination, so which puts him prone for the infection with the diphtheria and pertussis. So let us see the question. So question number 1, what is the diagnosis? So the diagnosis is going to be the case of diphtheria probably. And what are the points which is going to favor the diagnosis? So here is going to be the pediatric child, so no proper vaccination history. And that's going to be fever, and that's going to be grey-white membrane in pharynx. So this is going to be the point which is going to favor the diagnosis.